I am Nesrin Samsodin. So for today's video, I will perform the hand washing using this soap and water. So hand washing. What is hand washing? Hand washing remains the best method to decontaminate hands. Hand washing, as opposed to hand hygiene with an alcohol-based rub, is required when hands are visibly dirty, when hands are visibly soiled with or in contact with blood or other body fluids, before eating and after using the restroom, if exposure to certain organisms such as those causing anthrax or Clostridium difficile is known or suspected. So our equipment in this procedure is antimicrobial or non-antimicrobial soap. If in bar form, soap must be placed on the soap rack. Paper towels, oil-free lotion optional. So our assessment is to assess for any of the above requirements for hand washing. If no requirements are fulfilled, the caregiver has the option to decontaminating hands with soap and water or using an alcohol-based hand rub. So our nursing diagnosis is to determine the related factors for the nursing diagnosis based on the patient's current status. An appropriate nursing diagnosis is risk for infection. Many other nursing diagnoses also may require the use of this skill. So the expected outcome to achieve when performing hand washing is that the hands will be free of visible soiling and transient microorganisms well eliminated. Other outcomes may be appropriate depending on the specific nursing diagnosis identified for the patient. So let us continue to our implementation.
First step is gather the necessary supplies. Stand in the front of the sink. Do not allow your clothing to touch the sink during the washing procedure. The sink is considered contaminated. Clothing may carry organisms from place to place. Next step is remove jewelry if possible and secure in a safe place. Because removal of jewelry facilitates proper cleansing, microorganisms may accumulate in setting of jewelry. If jewelry was worn during care, it should be left on during. Next step is turn on the water and adjust first. Then wet the hands and wrist area. Water should flow from the cleaner area toward the more contaminated area. Then use about 1 teaspoon liquid soap from dispenser or rinse bar of soap and lather thoroughly. Rinsing the soap before and after you use more removes the lather, which may contain microorganisms. With firm rubbing and circular motions, wash the palms and back of the hands, each fingers, the area between the fingers and the knuckles, wrist, and forearms. Friction caused by firm rubbing and circular motions helps to loosen dirt and organisms that can lodge between the fingers and skin crevices of knuckles on the palms and the back of the hands, and on the wrist and forearms. Continue this friction motion for at least 15 seconds. Length of hand washing is determined by the degree of contamination. Then use fingernails of the opposite hand or a clean orange wood stick to clean the other fingernails area and nails. High microorganisms count and microorganisms may remain and other nails can grow and spread to the other persons. Then rinse thoroughly with water flowing toward fingers. Running water rinses microorganisms and dirt into the sink. Pat hands and dry with paper towel, beginning with the fingers and moving upward toward forearms, and discard it immediately. Use another clean towel to turn off the faucet. Turning off the faucet with a clean paper towel protect the clean hands from contact with a soiled surface. Then last is use oil-free lotion on hands if desired. So in this video I have no oil-free lotion, so I can't perform it.